Your hormones, the Live Younger Action Plan. In many ways, hormones are your body's regulators. They regulate your energy supply, water supply, and heating levels. They regulate your ability to handle stress. They even regulate the ability to conceive and the desire to have sex in both men and women. But even small deviations from normal levels can make you feel weak, tired, and uninterested in doing the horizontal tango with your spouse. It's one of your body's most mysterious equations. Hormones control some of the under-the-radar aspects of our body, the qualities that we often take for granted. Of course, medicine is busy perfecting ways to tinker with hormone levels artificially to make sure you live as comfortably and happy as you can. And we think there's a great future in the use of these methods. That's not to say that you can't do a little tinkering yourself. And we're not just talking about your gonads here. Certainly, if there's one thing we want to stress, it's that hormonal deficiencies aren't just things you need to accept. Not only are being tired, having less sex, or gaining weight quality of life issues, but they're also health issues. All of these symptoms make you more prone to aging. Certainly some hormonal problems like diabetes have stronger long-term health implications than others. But remember, the one overriding thing that ties your endocrine system together is that your hormones are connected to your brain. So here's something to think about. Without optimal hormone levels, you won't have optimal brain function. While you have less control over your hormone regulators than you do over other parts of your body, you can still take many steps to keep your hormonal levels as balanced as a tightrope artist. Action 1. Control your blood pressure. You'd think that a discussion of blood pressure belongs in the chapter on your heart and your arteries, and it does, since blood pressure is all about the volume and pressure of blood traveling through your arteries. But it also belongs here because it has such a huge effect on how your endocrine system works. High blood pressure magnifies the aging and symptoms associated with diabetes, causes kidney failure, and many other hormone-related conditions, and be triggered by thyroid, adrenal, or kidney problems. Optimally, you want to keep your blood pressure at 115/75. That's the level at which you'll see the least aging. Of course, there are many ways to lower your blood pressure, including medications, physical activity, and diet. A great approach that also helps your whole endocrine system is to lose extra weight. Being overweight not only increases blood pressure, it also puts you at risk for diabetes. Historically, obesity protected man against long periods of famine, so the body could call on excess fat to live. In most societies today, that's no longer a problem, so the body doesn't need to protect you against starvation. We've already discussed how essential physical activity is to your heart, bones, and whole body. It's also paramount for your endocrine system, especially for people at risk of developing diabetes. Not only will exercise help control blood pressure, something very important also happens during that hormonal process. The sensitivity of your muscles to receiving glucose also increases. When you exercise, your endocrine system releases insulin to transport that glucose-based fuel to your muscles and makes the insulin work better in getting glucose into your cells so the glucose can be used rather than leaving it at high levels in your bloodstream. In fact, it's rare to find people who exercise who don't decrease their blood sugar levels at the same time. The best news is that you don't need a dramatic loss from the start to see the effects. If you lose just 10% of the weight you gained since you were age 18, that's only 4 pounds if you've gained 40 pounds. You can make yourself up to 5 years younger. By extension, that same 10% weight loss will usually decrease your blood pressure by levels of 7 millimeters of mercury from the systolic, the top number, and 4 millimeters of mercury from the diastolic, the bottom number, which can have the real age effect of making you more than 2 years younger. Action 2, know your meds. We spend about as much time on medication as most men spend during foreplay. Roughly 23 seconds. That's not a critique of medication. In fact, the development of pharmaceuticals is one of the most important medical developments in history. For the most part, though, we're here to show you methods for prevention, ways to beat the problem before you need to worry about medications. Hormone problems are a little bit different. Most of them are easily treated with medication, and hormones are a very subtle, fickle part of your body. How you take hormone medication can have a major effect on how your body reacts to it. For example, for those requiring thyroid medications, consuming iron, calcium, or soy less than 4 hours before taking the thyroid hormone can mean the thyroid medication won't be absorbed. That's why it's important to review a few things about hormone-related medications. Estrogen. Though there's much debate about HRT, or hormone replacement therapy, it does appear that dermal estrogen, that is, estrogen applied to the skin, is safer than the oral, that is, the pill form, of estrogen. It also appears that the pill form goes directly to the liver and increases the clotting proteins that can make you more susceptible to closing off your arteries. The dermal form, on the other hand, does not get metabolized as quickly in the liver. If you choose HRT therapy to deal with menopausal symptoms, it seems that human estrogen, not plant-derived estrogen, is the most effective. Why? Plant estrogens have 150 isoflavones that interact with estrogen receptors in your body. Some stimulate estrogen, while others block it. So you really don't know which are having an effect and which aren't. Lastly, remember to take an aspirin if you're on HRT. Cortisone. Cortisone, a steroid used to treat all kinds of inflammatory conditions like skin rashes, arthritis, asthma, and lower back pain, works by decreasing the inflammatory response and inflammation. But taking too much cortisone can also have a negative effect by increasing your risk of elevated blood pressure, increasing your risk of infections, causing you to hit more hormones than usual, and thinning your bones. If you're worried about the potential side effects of taking cortisone, you should talk to your doctor about taking it every other day, or taking a small dose one day and the regular dose the next. When you alternate days, your potential for side effects can decrease by more than 80%. By decreasing the inflammation with steroids, you can often decrease the pain associated with inflammation. Blood pressure treatments, including medications. Since blood pressure affects so much of the endocrine system, it's worth noting some tricks to find a treatment program that works best for you. To lower blood pressure, you need either less fluid in your arterial pipes, a less forceful pumping of fluid into your pipes, or larger pipes that can open even wider when the blood is pushed in. A common first step before trying medications is to reduce salt intake in your food, since the salt traps water in the body. But only a few people with hypertension are extremely salt sensitive, so this approach often fails to totally correct the problem. Instead, the salt can be chased out of the arterial wall, and thus the body, with long-term, that is years of, salt restriction in diet, or regular use of water pills or diuretics. Parsley is a natural diuretic. Beta blockers are commonly added to the diuretic because they decrease the rate and force of heart contractions. Both actions push less fluid per minute into the pipes.